Hi everyone, I'm Dr. Sree here and I've been trekking for 15 years, and for the past 2 years I've been providing digital medical consultations and digital medical certificates to trekkers who are trekking with Indiahikes on a Himalayan trek. Almost all trekkers have this question when they consult with me. They ask about Diamox. Should I take Diamox for my trek? Is it safe? Is it mandatory? What are the side effects of Diamox? Today I'm going to be answering this question. So basically, getting acute mountain sickness on your trek depends on two factors. First is the highest altitude that you're climbing to, and second is how fast you climb to that altitude. So on treks that go up to around 12,000 to 13,000 feet like Kuwari Pass, Daira Bughyal, Surya Top, Deorietal Chandrashila, you do not have to go on a preventive course of Diamox, because you start the trek at around 7,000, 8,000 feet and climb up to this altitude over a span of 3 days, which gives your body enough time to acclimatize. Just remember to keep yourself well hydrated. Try to drink at least 3 to 4 liters of water daily. Eat well and get enough rest both before and during the trek. This will be more than enough. On treks that go up to 14,000 feet or higher, like Rupin Pass, Buran Ghati, Goichala, you have a forced ascent, which means that your body does not get enough time to acclimatize. You have to go on a preventive course of Diamox for these particular treks because they basically increase your chances of getting acclimatized more easily on the trek. Ensure that you start taking your preventive course of Diamox when you're on the plains, at least 2 days before you start the trek, and then continue it till you reach the highest point of the trek up till 11,000 feet. After that, you can stop taking the preventive course of Diamox. If you decide not to go on a preventive course, ensure that you carry Diamox with you and inform your trek leader in case you have any issues. Remember that you might be sent back down from the trek in case you have a severe case of acute mountain sickness. So being on a preventive course of Diamox does not prevent you completely from getting AMS, but greatly helps you acclimatize better. A little bit about how Diamox acts. Diamox is an over-the-counter drug in India, which means that you do not need a physician prescription to buy it. Also, it's a very safe drug and does not have too many side effects. Most trekkers in my experience say that the only side effect they experience with Diamox is a tingling sensation or a pins on needle sensation in the tips of their fingers and toes. Some trekkers also say that they have acidity or diarrhea with Diamox, but this can be greatly prevented if you ensure that you take Diamox after your meal in the morning and in the evening. Diamox is a sulfur-based drug. So if you're allergic to sulfur drugs like penicillin or any other antibiotics, ensure that you check with your physician before starting a preventive course of Diamox. Also, if you're already on medication for hypertension, diabetes or any other disorder, or if you have kidney issues, please check with your physician before you go on a preventive course of Diamox. On the trek, in case you have any issues like headache, dizziness, difficulty in sleeping, anything, just inform your trek leader. Don't take any medications on your own because your trek leaders are trained in wilderness medicine and they'll be able to guide you appropriately. They'll also be doing regular health checks of the team throughout the trek. So keep them informed and they'll be able to keep an eye on you. So I've answered all questions that trekkers usually have with respect to Diamox. In case you have any other concerns or questions, please drop them in the comments. This is Dr. Sree and see you in the next video.